Thank you for attending the second webinar in the VITLAccess series using the provider portal in your organization. My name is Joanna Cummings and I'm the marketing manager at VITL. So what I'd like to do now is introduce our presenters, but before that I wanted to let you know that the slides that you will be seeing today and video will be posted on the VITL website within the next 48 hours, and the link will be emailed to all the webinar participants whether or not you attended. You will get the email. So our webinar presenters today are Suzanne McEachran and Ann Gilmat. They are e-health specialists on our client services team at VITL, and they work every day with providers to help them use the VITLaccess Provider Portal. So I am going to turn over the webinar to Suzanne.
So good afternoon, everyone. This agenda shows the topics we'll be covering in today's presentation, and hopefully, after reviewing each one, you will have gained a solid working knowledge of each item. I will start off giving a brief overview of what VITLaccess is, and then cover the legal aspects of obtaining consent. Ann will speak about the process of searching for patients and utilizing the emergency access or break glass feature. Ann will also review consent workflows and the medication query functionality which is available in VITLaccess. We will then move on to a discussion highlighting the value of using VITLaccess within your healthcare organizations, and finish up with reviewing some administrative functions and support. So what is VITLaccess? Basically, VITLaccess is a web-based service that allows treating providers with patient consent access to robust statewide clinical data available within the Vermont Health Information Exchange, which is more commonly known as the VHI. Many types of clinical data, which are listed here, are being sent to the VHI from numerous sources throughout the state. Currently, every Vermont hospital is sending patient demographics, lab results, radiology results, and transcribed reports to the VHI, and most are also sending pathology reports. Additionally, VITL has recently started receiving continuity of care documents, or CCDs, from several hospitals: Grace Cottage Hospital, Mount Escutney Hospital, and UVMMC. While CCDs are not intended to be a complete medical history of a patient, the CCD is a core data set of the most relevant administrative, demographic, and clinical information facts about a patient's health care, covering one or more healthcare encounters. In addition to the data that hospitals are sending, there are many other healthcare organizations sending their data as well, including many of the Blueprint for Health Practices, Dartmouth-Hitchcock Medical Center, and even home health agencies. Using VITLaccess gives providers up-to-date information about their patients. So now that you see what kind of information is available, how can you get access to this data? First, you must obtain consent. Organizations wishing to utilize VITLaccess first sign a business associates agreement with VITL to participate in the VHI, which means the organization has agreed to meet a set of requirements for using the Health Information Network. VITLaccess is a service used for sharing this information, and this consent policy is part of the Vermont statewide Health Information Technology Plan, which was adopted in 2014. This policy details the rules and rights afforded to both participating healthcare providers and their patients, and is available to view via the link shown at the bottom of this slide. The most important thing to note is that consent must be obtained in a written format by either the patient themselves or their legal representative. While there is variation in the way different states have built their health information exchanges, in Vermont we have what is termed a global consent. Global means that once a patient signs a consent form to allow access, any treating provider who cares for them either currently or in the future and is enrolled to use VITLaccess may have access to their medical information within the VHI. Patients do not have the ability to withhold certain information from certain providers. It is an all-or-nothing proposition. That said, it is a patient's choice entirely to give consent or not, and at any time it's the patient's right to change their mind or revoke their consent. Any organization obtaining consent from a patient is responsible for two main things. First, setting the consent status in VITLaccess as quickly as possible, and secondly, maintaining a record of receiving the consent. Records can be maintained by having the patient sign electronically directly into your EHR, or by obtaining a consent form and scanning a copy of it and saving it in your EHR, or actually keeping a paper file. Vermont is also what is termed an opt-in state. This means that patients are required to give consent in order to opt into VITLaccess, allowing their providers access to their medical data. When patients are asked if they would like to give consent, they may choose to either opt in, allowing access, or opt out, which obviously denies access, except in the circumstances of a medical emergency. There'll be more on that later. Patients are free to change their minds at any time, but once this consent has been signed, you don't need to ask the patient to sign consent again. Consents do not expire and are good indefinitely unless the patient is a minor. In the case of minor children, upon their 18th birthdays, the system will automatically terminate the consent on file and require the patient to sign a new consent form as a legal adult. Once an organization is enrolled to use VITLaccess, VITL will provide you with consent forms, revocation forms, and patient educational brochures to use. The educational materials are written at basically a 6th grade reading level, so most patients should be able to comprehend the value of giving your trusted healthcare provider access to their medical data. Our track record has basically shown that about 96% of patients asked to give consent actually do agree to opt in. Now I'll pass the presentership to Anne, who will jump in to show how to search for patients in VITLaccess.
Thank you, Suzanne. The first two topics we're going to cover are the two available patient search options in VITLaccess and viewing a patient's medical record without prior consent in the event of a life-threatening emergency, also known as break glass. VITLaccess has two patient search fields, one available on the home screen and the other being the patient consent module. I'm going to walk through the most efficient way to search for a patient and have immediate chart access or view and set patient consent. The first patient search option shown on the slide is the patient consent search box. You can access this module from the home screen, found under your username in the right-hand corner. It looks very similar to the patient search box on the home screen, with the exception of the word consent. If you don't need to access clinical or demographic data on the patient consent module provides a user with streamlined access to view or manage patient consent options. The consent module is a quick and easy way to look up multiple patient consent status prior to or during a visit. Reminder, no chart access from the consent module. The VHI has almost 2 million patients available to view in VITLaccess. When performing a patient search, the recommendation is to search by full last name, comma, full first name. This will limit the number of patients returned in your search. You can also search by date of birth, medical record number, or social security number, but the number of returned patients may be several pages long. Once you find your patient, select and click on the patient and the consent box opens. You can view the patient consent status and close the box, or if you have a signed patient consent form, you can set the consent status and select Submit. Later on in the presentation, I will walk through the recommended consent workflow in setting the consent status. By selecting the Home button in the upper left-hand corner, you will be directed back to the home screen. You can see the patient search box on the slide. Use the patient search field on the home screen if you need to view demographic or clinical data on a patient and you are involved in their treatment. Use the same patient search recommendations we reviewed on the first slide. Searching for the patient from the home screen will give you immediate access to the medical record if the patient has given prior consent. A patient who has chosen to opt out, they did not give their consent, will not show in the patient search result list. To verify if the patient has records in VITLaccess, navigate to the patient consent search module, search for the patient. If you don't find the patient, no medical records are available to view, and you do not need to collect consent at this time. If you feel this may be an error, please call VITL support. Additional records may be available It's going to show up on the home screen after your patient search list. We receive a lot of questions regarding this box, how to use it, and why it appears on all the screens. Additional records may be available, but is only to be used when you need to search for a patient who has previously opted out and the patient is presenting for emergency services. In the event of a medical emergency, a provider can view protected health information on a patient in an opt-out status. You can select the reason, follow the drop-down options, and then a new column will appear, RA, meaning restricted access. Patient access via the emergency override will create a break glass event and will be audited. The Access Additional Records box does not mean you will find additional medical records from other facilities, and it's not a HIPAA violation to select patients listed in the patient search result if you're involved in their care. Back to the patient search from the home screen. If the express consent box appears after selecting your patient from the home screen, this means your patient has not been asked to give consent. The express consent feature allows a patient's consent options to be updated directly from the patient's search screen. If you have a signed consent form, you may click Continue and Submit. If the patient has not signed a consent form, you will select Close. You will not be able to view the patient's medical record until signed consent is received. The exception is in the event of a medical emergency. You can select the radio button in your emergency override, select your reason, and you will have immediate access to view a patient's medical record. Once the patient has been treated and is stable, the patient must be notified their data was viewed in VITLAccess. This is also considered a break glass event. Now on to consent workflow. Collecting and managing patient consent in VITLAccess is a very important role. The consent status should be set the same day the consent form is signed and dated. Let's talk about the recommended workflow for a patient who has never been asked to give consent. You will navigate to the patient consent module, search and select your patient. In this case, the selected patient is in a default opt-out status, shown above on the slide in yellow. All patients are in the default status until they choose to opt in or opt out. The patient in the opt-out default status has not previously been asked to sign consent. You can present the patient with a consent form upon receiving the signed form back, set the selected consent status, either to opt in or opt out, and hit the submit button. The consent form collected must be retained as an electronic hard copy or a hard copy. Recommendation is to scan the consent form in your EHR or practice management software. Some clients have found doing chart prep the day prior to a visit saves time during the check-in process. There are many ways. We have a sample script of how to ask for patient consent. There are many ways to ask patients for consent, but to keep the message clear and concise, VITL offers the following script. We are partnering with VITL to give your treating providers access to your health information in the Vermont Health Information Exchange. To assist them with providing care, would you like your providers to have this access? You might find that your office staff is more comfortable phrasing the request in a different manner, but it is recommended that everyone within the healthcare organization ask for consent in the same way, using the same phrasing, keeping things consistent. A pediatric practice using VITLAccess asks for consent by saying, we partner with VITL so our providers can use VITLAccess. This service gives all your child's providers the opportunity to view medical information on your child, even if they end up being treated somewhere else in the state. Would you like to sign consent? So that's a sample consent script that one of the pediatric offices use. In the beginning and for new staff, it is helpful for staff to have the script printed out until they can memorize it and feel more comfortable with standard scripting. VITL's client service team is happy to assist with helping your organization with a script. we do have several during the training that we will hand out, and then you can incorporate your own verbiage in that. If the patient has previously given consent, the status will show as opt-in or opt-out in the consent module with an expiration date. The word default will not be present. You do not need to collect consent from the patient. Close the consent module. Do not select submit. Noting the patient's consent status within your own EHR may be a time saver and save work the next time the patient visits your office. This next slide is an example of a practice that we work with, showing that they scan the patient consent form into their own electronic health record. They check their own EHR before they look in VITLAccess to see if they find a consent form. If they don't, that prompts them to open up VITLAccess and then continue with the consent policy. Scanning the consent form in your own electronic health record will save time down the road. Initially, if the majority of your patients have not given consent, you can check VITLAccess first, but after the patients have given consent and you scan this in, it may be more efficient and save you time to check your own electronic health record or practice management system first. Now that we've talked about the consent policy, consent workflow, searching for patients, medication reconciliation can be a challenge. I'm going to review how you can use VITLAccess to reconcile a medication list. Nurse case managers, nursing home, and others are finding this to be a really valuable tool. After selecting your patient and with full patient chart access, you will be directed to the patient summary screen. The summary screen provides a summary of the most current 3 results, allergies, and problems. You can view clinical data by selecting the result or the report from the summary screen, but I recommend using the Encounters, Medications, or Documents tab on the left to see the bigger picture. I refer to the Encounters tab to be one-stop shopping. You can view all available data by selecting an encounter shown on the lower half of the screen. The provider's note, lab, radiology results will be on one document. The top half of the Encounters screen will show the patient's problem list, displaying ICD-9 and ICD-10 codes. The provider's note may reference medications given to the patient during the encounter or prescribed at the time of visit. This will help with reconciling for meds that have not been filled yet and found on the Medication Query tab. Clicking to the Medications tab, you can see in one place medication allergies alerts in a 12-month nationwide filled history, including controlled substances shown in red. Medication alerts can be drug-to-drug interactions or compliance issues noted by the pharmacy. You can see the last med query, when the last med query was run. If not current, run a new query by clicking on the blue Medication Query tab. It may take several minutes to return a current filled medication list. Medications from both claims data and pharmacy interfaces is being queried. Here you will find a patient's filled medications. You can print the list. There is a print button that will be an option to be able to use to help reconcile. Another option is on the Documents tab. Continuity of care documents, also known as CCDs or medical summaries, are viewable on the Documents tab and contain medication lists by healthcare organizations. To view a patient's medications at a healthcare organization such as their primary care provider, so you can select the most current available CCD, scroll down to the patient's medication list, which may contain discontinued medications and patient-reported medications such as herbal or over-the-counter medications. This list gives you a broader perspective of the patient's medical history and medications. So if you're trying to reconcile a patient's medication list using VITLAccess, you can go to the Encounters tab to view a provider's note, which may contain prescribed medications, or medications administered at the time of the encounter. Filled medications can be viewed from the Medications tab, and the CCD can be found in the Documents tab, displaying a primary care providers or specialist medication list, helping with viewing their medications, either prescribed or filled. Will help with the reconcile process. At this time, I'm going to turn the presentation back over to Suzanne.
Thanks, Ann. So, why use VITLAccess? If it isn't already apparent to you, there's many reasons. For patients who are new to you and may present without their medical records or very much information, VITLAccess may be a great place to start searching to locate past caregivers and medical information. For established patients, it can be a place to obtain additional records from other medical sources, building a broader view of their medical histories, and sometimes being helpful in tracking referral care. Because VITLAccess is available through a web-based service, it's available almost any time and long after regular offices and medical records departments are closed. This is proving quite valuable to some groups who share on-call duty after hours, but don't necessarily have access to each other's electronic medical records. Being able to see what medication was prescribed earlier in the day for a patient experiencing side effects is invaluable in dispensing over-the-phone medical advice in the middle of the night. Additionally, being able to see if certain radiology or lab tests have been previously performed and being able to see the results of these tests can obviously reduce the amount of duplicative testing. Interestingly, even if you think you have most of the data on any given patient, you may be missing something. Many hospitals in our state share information readily with their local practices, but what about all the other places a patient may seek care? The pie chart on the right side of the slide shows a breakdown of all patient data in the VHI for patients who have received treatment at Northwestern Medical Center over roughly about the past year and a half. When looking at the graph, we see that only 25% of the patient information originated at the local hospital. A full 75% of medical data came from other sources, about 47% from Vermont's largest academic medical center, and 28% from other community providers, including providers from NMC practices. Using VITLAccess will allow NMC providers access to other important patient data that would previously have required numerous phone calls, faxes, and signing of release forms to obtain information. VITLAccess can be extremely helpful in dealing with patients who are poor historians regarding their medical care. As Ann touched on earlier when she reviewed the medication query functionality, one situation healthcare providers encounter frequently is the patient who cannot remember details about or recall the name of the drug they are taking. They might recall the color and shape of a particular pill, but have no idea who told them to take it or what they are taking it for. Obviously, being told, I take the white oval one for my sugar, is not nearly as helpful as knowing that the patient is supposed to be taking metformin HCl 500, which was last filled with a 90-day supply and has not had the prescription filled in over 6 months. VITLAccess provides immediate access to clinical data to assist with capturing accurate medical history information. Having this additional information can also improve patient safety by reducing the potential for adverse events due to inaccurate or missing information. Both patients and healthcare staff having access to a patient's clinical data should reduce the stress caused by patients who cannot accurately recall pertinent information. For staff, this access can be a time saver by eliminating telephone calls and requests for information to be faxed. Another really valuable place to utilize VITLAccess is in the care of populations with chronic diseases. Due to the nature of their diseases and how complicated and fragmented specialty care can be, VITLAccess can be a great tool for providing immediate and expanded electronic access to community medical history data. This information may identify potential compliance issues and be helpful in determining if the patient is actually receiving follow-up care for their conditions. There are frequently barriers for patients which, if identified, can be resolved and lead to better patient outcomes overall. Again, in this situation, workflow efficiencies for staff are improved by fewer phone calls and less waiting on faxed reports. This scenario speaks to the fact that one of the largest risks for readmission after hospital discharges is due to medication errors. One of the challenges may be knowing which medications the patient was asked to stop and which new medications the patient actually filled after the discharge. Without this vital information, it's hard to create the best treatment plan, which can result in a lot of administrative work for the practice. Not having accurate information also puts the patient's safety at risk. Now that we really have your interest, we'll bore you with the details, client support, and administrative support. At the time of your organization's enrollment, you'll be asked to designate a local security officer. This person does not need to be the organization's compliance officer, but does need to be someone who agrees to the responsibility of managing and maintaining the staff with user accounts with VITL. The LSO has a number of responsibilities, and a large organization may have more than one person designated as their LSO. The LSO will manage the organization's staff using VITLaccess. So whenever there's an addition or change in staff, the LSO will submit an account request form to VITL via My VITL ticket. In the case of an employee termination, as soon as the LSO is made aware of the change, VITL should be notified in order to deactivate that user's account. The LSO will be the keeper of temporary passwords for staff who are unable to attend initial VITLaccess trainings. And the LSO will also assure that the patient consent forms are signed with their organization are kept indefinitely and in a manner which can be audited. The LSO will be expected to respond in a timely manner to VITL audit requests regarding emergency break-glass events to verify that the record was accessed based on the treating provider's judgment that there was indeed a medical emergency and that the correct steps were followed with respect to patient notification following the emergency situation. They will also respond to random audit requests initiated by VITL. These audits review the activity of random users of the organization and assess compliance with consent form retention. The LSO will also be the person who receives service alerts regarding any changes to the VITLaccess service and will communicate those changes as necessary to the organization's staff. The LSO is also instrumental in the processes for auditing and retaining reports. They may at any time request audits of specific users who work at their organization to determine what patient records were accessed by that individual. They will also coordinate requests from patients who would either like to view their data that exists in the VHI and or requesting an audit report of who has accessed their data through VITLaccess. Patients always have the right to request this information, and VITL must deliver the information within 30 days of the request per the policy. An important piece to being able to log into VITLaccess is the magical keys to the kingdom, the password. Because of the nature of needing a high level of security, passwords are required to be at least 8 characters in length and contain a letter, a number, and a special character. Once a password is selected, users will be prompted to set up 3 additional security questions. It is important to note that security questions should be something that won't be likely to change, like the color of your first car versus who's your favorite child, and that answers to security questions are case sensitive. For example, if the town you met your spouse in is Las Vegas and you capitalize the L and the V, know that you will need to do that going forward. If you're unlucky enough to have tried your password unsuccessfully 3 times, your account will be locked and will warrant a call to the support desk or sending in a My VITL ticket. Other times you might need to use the My VITL ticketing system are for the following issues: asking for help merging a duplicate patient listing, when you can't locate a patient record that you feel should be in the VHI, if you have questions regarding a patient's data. My VITL is secure so that you can send EPHI through our My ticketing system with no worries about that. And if you're an LSO and are adding or removing users from the system. The link to the ticketing system is on this slide, and it's also on the next slide are our support telephone numbers and hours of operation. The first number is specific for VITLaccess operating issues, whereas the number for consent questions below is more for patients with questions and or concerns regarding patient consent. Feel free to call us with any kind of question regardless of how silly it might seem. This is really what our support staff is here for. At this point, I'm going to pass things back to Joanna to wrap up this afternoon's presentation.
Thank you, Suzanne and Anne. That was very informative. I wanted to let you know as well that when you do become a user of VITLAccess, that we provide printed materials, including a brochure that you can give patients on consent so they can understand more about what they're signing and who to call. The consent number is in that brochure, so the patients will have that when they leave your office if they want to make a call to VITL and ask more questions about consent. What I'd like to do now is let you know, just again, a reminder that we do have a third webinar in this series, and it is the VITLaccess Advanced Training and Live Demonstration. The topics will include integrating the use of VITLaccess into the organization's workflow, advanced training on medication queries, CCD content, care setting specific use cases with demonstration patients, and transitions of care. You could certainly follow up by emailing clientservices@vitl.net and call us at 861-1800 or email Judith Franz at jfranz@vitl.net. I'd like to thank you for taking the time to attend this webinar. It is recorded and will be posted on our website, and again, you will receive an email with the link. I hope you have a great day, and please let us know if you'd like to sign up for VITLaccess.